AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Camera every now and then. Hi, welcome. I'm Lorena Anderson, your life and energy coach. I'd love to welcome all of you to You and Your Doctor, where teaching you how to live a healthier and longer life happens to be our motto here. And that's one of the reasons why we're on. We're being produced by AMP2 TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. And that's one of the reasons why I really want to emphasize that they have gone over and above in being able to provide us with the experts out in the field so that you can be well informed and educated as to the type of doctor that you might need and or some of the other things that are very, very important to you, whether it is some aches and pains and ailments or whether it has to do with insurance and Medicare and what to look for. All of that has been brought to us by All County Healthcare by sponsoring this show. We are here every Tuesday between the hours of 6 and 7, and we have some of the best doctors. One of the other things that I want to bring to your attention, though, is that these doctors really speak about All County Healthcare and how they treat their patients. These doctors that we have coming on, they have such incredible expertise. They've been in the business. They're one of a kind, and they are compassionate. They are warm. They are willing to listen, which is something that I think many doctors have fallen away from. But with these doctors that we have on, they really do. They are so good at listening to you and hearing what is going on, and they want to know. So, with that being said, we have two fabulous doctors on today. We're excited, very excited. Our first doctor is Dr. Shapse, and he comes to us with all sorts of information about diabetes. So, welcome. It's great to have you.
Nice to be here.
Great, super. Now, if you want to, please, we're on the radio live, 1470 AM, and we're also on 95.3 FM. So please give us a call. If you have any questions whatsoever, give us a call to All County Healthcare. The telephone number is 888-717-7170. Ask for Maddie. She'll be able to get you in touch with any of the doctors that we might have here this evening. And also the other doctors that we've had from prior shows. You can find that on allcountyhealthcare.com in the archives section. Plus, just in case you missed tonight's show, it is going to have a replay on Tuesdays, 95.3 FM at 11 o'clock a.m. and 3 o'clock p.m. So let's get on with our discussion here. It is wonderful to have you. Thank you so much for taking your time out and being with us tonight.
You're very welcome. Nice to be here.
Great. So tell us, first of all, where are you located?
I'm located in Delray Beach on West Atlantic Avenue, west of Military, next to the flea market.
Okay. Well,
so if there's a wait, you can go to the flea market.
That sounds great.
But, it's convenient.
Oh, that sounds super. And what's your telephone number in case somebody needs to get a hold of you?
561-496-0176.
Okay, great.
I never have to give my number out like this. That's cute.
Sorry about that. I didn't mean to catch you off guard.
That was a trick question right at the beginning.
Jeez, I'm bad. So, where did you start? What made you decide to get into this field?
Well, endocrinology is always a very interesting subject for me. There's plenty of diabetes in my own family. And that, I guess, was the impetus to start out. But what I like about endocrine is that it is a mechanism-driven specialty. You have to understand what's going on at a molecular level. And that's very exciting for me.
That is very
You
exciting.
understand how things work. And if you understand how things work, you can understand how to treat.
Yes. Yes. Excellent.
So that would be how I started.
I see. That's so interesting because a lot of the doctors that I have on, the majority of the time, they're dealing with some sort of ailment themselves that created the passion for them to go into the field that they're practicing. So for you to say that you've had a lot of diabetes in the family, and that gave you the passion then to find out more about it and study it and make it your profession, that's absolutely amazing, that correlation there.
Unfortunately, I didn't develop diabetes.
Well,
I don't plan to.
Yeah, that's a great thing. Yes, absolutely. I agree with you. I'm not there either. So, where did you study?
I studied my endocrinology at the Joslin Clinic in Boston.
Oh, okay. All right.
It was a fellowship program, and then I went on to private practice in Englewood, New Jersey, but then we came down to Florida in 1992. So I've been down here a long time
You
already.
just see it feels like just around the corner, doesn't it?
Yeah, it goes fast.
It does. It does. And well, that's great. How long have you been in practice down here? I mean, have you been in that location for quite some time?
Well, we started out in Boynton Beach, and then 6 years ago moved down to Delray. But altogether in South Florida, I've been in practice for 26 years here.
Wow. So fresh out of college, right?
Something like that. Something like that, yeah.
Excellent. Well, I'd like to find out more. Give us some insight on diabetes. I know that there's quite a few different strains or types.
There's only two types.
Just diabetes 1 and diabetes 2,
right.
That's it?
Most diabetics are type 2 diabetics.
Okay.
And one of the misconceptions about diabetes is that people say, oh, it's high blood sugar. High blood sugar is just a symptom. What diabetes is, at base, is a problem with fuel use. We use glucose, sugar, to run our bodies. When we cannot efficiently use sugar to run our bodies, then problems develop. And that's really what diabetes is. What I like to equate it to is like if you have a car with a bad fuel pump, that you can't get the fuel where it needs to go. And that's the situation with diabetes. Adult diabetics, type 2 diabetics, really have insulin, but they have insulin resistance. They can't use it.
What creates that resistance?
First thing that created is obesity. When you're fat,
really?
You cannot use your insulin as well. And then the body produces more insulin to try to compensate, and then you just get fatter.
Wow,
so
that's very interesting.
So that's one of the big things. And of course, in America, we have an epidemic of obesity.
We do,
You know,
yes.
we eat terribly in this country. We
yes.
really do. And, but there are genetic factors, too. And,
so the fat then does not allow the body to assimilate, to take in that insulin?
Well, no, insulin works. You got plenty of insulin. Insulin works to allow sugar to transport from the bloodstream, which is the transport net, into the cells where it's needed for energy.
Okay.
And there are receptors on the fat cells that have to be activated to allow sugar to be transported. Sugar does not go passively into cells by and large.
Okay.
So,
all right.
Again, mechanism, that's very important.
Yes.
So one of the big things that we like to do is focus on how to overcome insulin resistance.
Okay. Now, I've heard that it is a huge epidemic that we are dealing with in our society today.
We are.
And, how do we start identifying it, or what do we need to do to reduce the diabetes?
One of the best things we can do to reduce diabetes is to reduce obesity in this country. I sit and watch TV at night, and you have the food ads, and they oh, you get this super burger and the stuff's dripping with fat.
I know.
And I get repulsed because
I
I said
know.
my arteries are going to get clogged from this stuff.
I mean,
and it doesn't do anybody any good.
There's 2 fast food companies right now, and they've got the super brand new burger, and then they super deluxe brand new burger, and I'm
Right.
going, no.
Your stuff's dripping with fat. It's
Yeah.
it's
And
really horrible.
let's not forget the bacon.
And the bacon.
Oh goodness. Yes,
It's terrible.
it is, but it's what I find it difficult to wake up the public. Stop putting this stuff into your body. Look to see what you're doing to your body.
People like to eat.
Yeah.
And people don't like to move.
Yeah.
So they sit in front of the TV, they see the commercial, like, oh, I'm hungry, and then they go eat more, and then they
Yeah.
get heavier and heavier.
And then
So it's a big component.
It is a big component. I kind of equate it also with like a food addiction, because once that craving starts, it's searching for salts and fats and sugar.
Absolutely.
Yeah. Wow.
Yeah.
So what are some of the ways that you end up treating that?
Yeah. Now, we have a lot of tools now to treat diabetics with. When I started out, we had almost nothing. We had some rather crummy animal insulins that we used, and we had a couple of oral agents that weren't terribly effective. Now we have new agents that are fantastic. We have some of the old agents, which are still quite good. One of the oldest agents that we have is metformin, which has been around for a long time, and it's still the workhorse. Because what it does is helps you reduce new sugar formation from the liver, which is a big issue. Most people think, oh, well, not enough insulin, and that's why the sugars are high. No, one of the biggest problems with adult diabetics is that the safety mechanism we have on board, which is the ability to produce sugar out of the liver, is never turned off. And so the liver will produce a lot of extra sugar. Then the insulin that we need to help transport sugar into the cells is not very effective. And so a lot of sugar builds up in our bloodstream, which causes all sorts of problems for us.
Wow.
So
Okay.
we look to attack the different pathways that affect the sugar. Medications that affect the liver's ability to produce sugar, very important. Metformin cuts down the production of new sugar out of the liver. We have a new class of drugs called, such like Byetta and Bidurian and Trulicity. There's so many, I get confused. Trulicity. These are what's called GLP-1 agonist drugs. And what they do is they cut down the liver's ability to produce sugar. They slow down the absorption. They slow down the transit of food in the stomach, so they don't dump as much sugar. They affect the brain by decreasing the appetite to a small extent, and to a small extent too, they will increase the secretion of insulin, but that's minor. And so this sort of drug is fantastic for making people's blood sugars go down and not making them gain weight.
Wow.
Older medications like the sulfonylurea drugs, the glucotrol, the glyburide, which causes increased secretion of insulin, helps you get fat. It's not the best way to go. And most of these drugs are used less frequently than they used to be used.
Yeah.
Though we still use it. There's still a role for it, but it's not as pronounced.
Well, I remember, correct me if I'm wrong, that the new breakthroughs that have been happening in like the last 5 years have been really astonishing, because the brand new drugs that are coming out, from what I understood, one of my clients was diabetic, type 2 diabetes, and she was saying that she was having such a difficult time trying to keep it under control because there really wasn't any good medication for her, and then all of a sudden she started going through drug testing and with one of the new drugs and had found great success with it.
Yeah, I mean, there's great tools. We now have a lot of tools, and what I find that the new drugs do help you lose weight and controls the blood sugar a whole lot better. One of the trends going on now, which I'm not happy with, is that we're getting these newer concentrated insulins coming out. And my fear is that there's going to be overuse of insulin. In my office, I get patients who are on tremendously large doses of insulin, and their sugars are out of control. Because the one thing that they don't realize is insulin itself downregulates its own receptor. And that's a safety mechanism we have in our bodies.
Right.
So if somebody comes in on 120 units of insulin, I get out my insulin machete and cut it in half or in a third, and the insulin will work more effectively at lower doses. So with the newer U200, U300, the concentrated insulins, I think there's going to be some overuse, and I don't think that's going to help us. And also, insulin makes you gain weight. So you really have to, insulin has a great role to play. I'm not downplaying it, but you have to use it cautiously and not overdo it. Otherwise, patients will end up in more trouble, not less.
Right.
Because we want our patients to lose weight.
Absolutely.
So
Absolutely.
we get to the new.
We'd also like them to change their diet behaviors.
We'd like them to change it. And that's the tough.
That is tough.
I have patients come in, they brag to me how they're eating cakes and cookies and
sausage and bacon
and all that stuff.
Oh my goodness,
that
yes.
They're overeating. They're sort of proud of themselves. Yeah, I'm doing it. My blood sugar's nearly not that bad.
But I'm cooking for myself.
Some are.
And some aren't,
yeah.
huh?
Yeah.
Well, I'd just like to take this moment to say thank you to All County Healthcare for bringing such an amazing professional here, such an incredible doctor, and for giving us the ability of understanding how diabetes is working. And not only that, the sugars and the insulins, and understanding how that works within our body. So that's wonderful. Can you tell us the difference between type 1 and type 2 diabetes?
All right. Most of the diabetics are type 2 diabetics. These are the patients who have resistance to insulin.
Okay.
All right. They tend to be overweight. Not all of them, but most tend to be overweight, and they don't respond well to insulin. Type 1 diabetic is the typical juvenile diabetic, and that's less than 10% of all diabetics.
Oh, okay.
And these are the usually present in, as children. And the kids get very sick. They go into something called diabetic ketoacidosis. There is true lack of insulin. These kids have antibodies to their pancreas, destroys the insulin production capacity, and these patients get acidotic. They get very, very ill. In the old days, they used to die from this.
Wow.
And insulin was a godsend, was really a godsend. All right, so after 1922, when it became available, the change in prognosis was amazing.
Wow.
But this is for type 1 diabetics. And this is a lifelong disease. You never get over it. But again, we have all sorts of modalities to treat with. We have a lot of kids on insulin pumps and things like that. And we're waiting for the day where there's what's called a closed loop pump, where you have a sensor that senses the blood sugar, gets back to the pump, and decides how much insulin to give. We're
now,
not there yet.
We're not there, but have you seen glimpses of that technology being formulated?
They're working like crazy.
Are
they
they?
have all sorts of components. We have all sorts of monitoring, continuous monitoring setups that we use separate from the pumps at this point. But, they're working hard to integrate the thing.
That is incredible.
So there's a lot of interesting things going on. And for type 1 diabetics, that's tremendous.
Yeah, that is, because especially, for our kids, we never want to see our kids hurt in that manner or sick. And so that's really exciting news.
So it's great stuff. I work with only adults. We're here in South Florida,
Yeah.
where basically anybody under 65 is deemed pediatrics.
Okay, good. I'm
That's
still
good.
a pediatric.
Still pediatric is good. But the big problem in the country is not type 1 diabetics, but the type 2 diabetics, and that is they're growing in number.
Oh goodness!
And fortunately, we're finding these patients much earlier. There is better awareness out there. Which
There
is
is.
great.
Oh, that's
and
good.
we're finding these patients earlier, and we're treating them earlier. And what we're looking to do is prevent complications. Why treat diabetes? If it's just high sugar, why treat it? And the reason to treat it, it's a devastating disease. I call it a slow cancer.
You're absolutely right. It is.
because it affects blood vessels. So you have heart disease, strokes, peripheral vascular disease. Most amputations in this country are still secondary to diabetes.
Wow.
It's a terrible scourge.
Well, talk to us about the legs when it comes to diabetes. I mean, I've seen quite a few individuals that have diabetes, and their legs look like they swell up and turn red and.
Well, that may be from diabetes. There are other reasons for the big edema on these patients, but foot care in the diabetic is very important because a lot of adult diabetics have neuropathy. They don't feel their
they don't
feet.
feel
There's
them.
other parts of the complication, what we call microvascular complications, is peripheral neuropathy, kidney disease, and eye disease. The retinopathy.
Really?
Yeah, people used to go blind on a regular basis from bleeding inside the eye.
Oh,
We
my
don't see
goodness.
as much of that anymore. Now, we see it more in type 1s than type 2, but plenty of type 2s do have retinopathy, eye problems from the diabetes. So we want to treat the complications before they become serious because, one of the leading causes of kidney failure, diabetes.
Really?
Diabetic eye disease is up there. Vascular disease, as we were just talking about,
Right.
leading to amputations. It's a terrible thing.
Yeah.
And even if you don't get to the amputation, the problems with pain, with bad circulation and pain between the circulation and the neuropathy is awful. Lifestyle, quality of life
Yes.
really goes downhill with uncontrolled diabetes.
Absolutely.
And
Absolutely.
then the neuropathy itself. The nerve pain, we see a lot of commercials for several products out there. And they're effective, they're good. But the nerve pain's terrible. You can stop your neuropathy from getting worse by really controlling your diabetes.
And your food intake.
And
as
your
well?
food intake is part of it.
Yes, yes. And exercise as well.
And exercise. Yeah, I'm glad you brought that up because that's the tripod of treating diabetes. Proper diet, regular aerobic exercise, because you want to burn calories, and medication. Okay, we have lots of medications to use, but you are what you eat.
Exactly. I might even want to put one more in that, and that is either therapy or counseling to really get yourself on track. Because a lot of times people can eat emotionally.
Oh, absolutely.
And that also leads to that self-medication and how
It's comfort food.
Yeah, exactly. And they have felt that, oh well, it's okay because I've been doing it for so many years. But I'm like, take a look. It's not okay. You're not happy. You're not healthy.
Right.
You've got decreased lifestyle skills and capabilities now because of your health. How much further do you want to go down the hill before you wake up?
Well, that brings up another related point. Diabetics notoriously get stuck in the period of denial.
I know. That's exactly what I was going to say.
They're huge deniers.
Oh, yeah, exactly. Oh, no, I'm fine.
Yeah.
I'm doing great. I can walk up, 2 stairs at a time every 5 minutes. And it's like, no, come on. This is your health. Don't play games with it. And the older that you get, audience, the worse it becomes. It's not going to get any better. So that's one of the reasons why we've brought one of these professionals on to help educate you. But not only that, call us. You don't need to be going through this pain and suffering. There are so many wonderful things out there. All you have to do is give us a call. Give us a call, County Healthcare, 888-717-7170. Ask for Maddie. She can put you in touch with the doctor then. And you want to give your telephone number again?
If I got it right. 496-0176.
Okay, here's a better way. What's the name of your practice?
Yeah, William A. Shapse, MD.
Okay. And that's the name that they can find on the door?
And they can find it right on the door. We're at 302. We're at 5341 West Atlantic Avenue, Suite 302.
Oh, okay.
In Delray.
Okay. And
next to the what's it called?
flea market.
Big Apple Flea Market, I guess it's called.
Okay. And you spell that Dr. SHAPSE.
Yes, indeed. indeed.
And just ask for Maddie at All County Healthcare. She would love to put you in touch with the doctor to be able to answer any questions. But please, 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 don't take any more time. Don't waste any more time. If you're dealing with some level of diabetes, please give him a call.
Thank you.
You're welcome. What are some of the other symptoms that they can tap into so that they know that they're dealing with an issue?
Well, the classic symptoms, if suddenly you get very thirsty and you can't quench your thirst, you have severe hunger that you don't know. I mean, these are the classic symptoms. You may be losing weight, but type 2 diabetics tend to gain a lot of extra weight because
they do it fast, correct?
And they do it relatively fast at times. And they're running to the bathroom all night long. That's usually the
telltale signs?
The telltale sign that all of a sudden you're going 3, 4, 5, 6 times a night to go urinate.
Oh, okay.
Where you didn't do it before. And that's usually a big red flag.
Gotcha. Okay. So you've got the symptoms. If you're dealing with any of that, please just give us a call. Well, I can't thank you enough for taking time out, for coming and being on the show, for helping to educate our audience and give them some more knowledge. And hopefully, if they are dealing with some issues of this sort, to get up off the chair and make a phone call. You know, denial is not your friend, and it's not a river in Egypt either.
That was my joke.
So thank you very much. It was wonderful to have you here.
Thank you.
And we're going to break for commercial. Don't go anyplace. We have another doctor, Dr. Wang, who's going to come in and also teach us and inform us about his particular specialty. So don't go anyplace. Come on back. We'll see you in a few seconds.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. From simple sprains to highly complex surgeries, the Orthopedic Center of Palm Beach County has been serving the South Florida community for over 65 years with the finest orthopedic and pediatric care. Our physicians are each experts in their field, providing a complete spectrum of musculoskeletal care from prevention and diagnosis to treatment and rehabilitation for every part of the body in both children and adults. Our doctors are able to perform the most advanced treatment options available, including PRP therapy, stem cell, arthroscopic surgery, and microsurgery. At the Orthopedic Center of Palm Beach County, we are dedicated to providing a comprehensive solution to get you back to your routine as quickly as possible, in the shortest period of time, with the least amount of inconvenience. With 3 beautiful new offices located in Lake Worth, Boynton Beach, and Wellington, we are able to provide much-needed care to families in the South Florida area. Give us a call at 561-967-6500. From our experienced physicians to the most advanced treatment options to our state-of-the-art facilities and excellent support staff, the Orthopedic Center of Palm Beach County is committed to providing you with the very best care. Call us at 561-967-6500 or find us at www.ocpbc.com.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, Or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need. And he means it. At All County Healthcare, I see my patients until their goals are met. And I never worry. I hope you never need a nurse to come to your home. But if you do, tell your doctor, I want All County Healthcare.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. I'm Lorena Anderson, your life and energy coach, and also your host for this evening, You and Your Doctors. And it is being produced by Amplitude TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. You can watch us live on Facebook at All County Healthcare. We are running live web, internet, TV, and also wwnnradio.com. So if you would like to ask any questions of the doctors, please just give us a call. You can call All County Healthcare at 888-717-7170. Ask for Maddie. She will love to answer any of your questions that you might have, especially for home health care issues. And she can also get a hold of the doctors that are on our show this evening. So without any further ado, I would love to welcome our next doctor, Dr. John Wang. It is
Thank you very much.
Wonderful to have you here. Thank you so very much for taking...
Thank you for having me on.
Oh, we really appreciate you taking the time out and coming in.
Sure.
And
It's my pleasure.
being a part of the radio show. Yeah. So, well, first of all, tell us where are you located? How do we get a hold of you?
I practice in Palm Beach County. I have an office in Boynton Beach and an office in Boca.
Okay.
And, we're primarily in the southern part of the county, and we're on staff at Bethesda, Delray, and Boca Regional.
Okay, great. And telephone number, website?
Website. It's pretty simple. It's www.ortho-surgeon.com. So
okay.
That's all
that's
it is.
Easy.
Yeah. And our practice is Orthopedic Surgery Associates, and that could be searched or Googled as well.
Okay. Mm-hmm. Say that one more time, just in case somebody's writing down. I want to make sure that you get this.
All right. It's ortho-surgeon.com.
That's simple enough. Right. Yes.
Yeah, we're pretty proud of that. So
excellent. And the name of your practice?
Orthopedic Surgery Associates.
Okay. Mm-hmm. Great. Super. And just in case you aren't able to be with us this evening on 95.3 FM, you will be able to hear our taping on Tuesdays on 95.3, and we air at 11 o'clock a.m. and 3 o'clock p.m. So just in case you weren't able to be with us for the duration of the show, or you missed the show tonight, you can always watch us again on Tuesdays. So, your specialty. Well, first of all, where did you
come from?
Where did you come from? Where was your schooling?
Sure. I grew up around Washington, D.C., actually. That's where I grew up. And I attended school and graduate school there. I went to Georgetown for medical school.
Love Georgetown.
So I did my surgical residency, orthopedic surgery residency in Miami, and that's what brought me down here. And got used to the weather.
you never left.
Loved the water, and I never left. And I went away, did an additional year of training in New York at special surgery, and then I just came back to the area because I love it so much.
Yes. Yeah. You ran back.
Well, we flew back, but
I understand the weather component because I'm from Chicago.
Okay, yeah, I spent a year in Chicago as well for a surgical internship. In Loyola in Maywood.
Oh, yeah.
I just remember trying to scrape ice off my car at like 3 a.m. It was
brutal.
It was brutal.
Brutal.
Yeah.
I know. As a matter of fact, in Chicago, one of the smartest things that you want to do is to get an automatic ignition starter.
Oh yeah, right. So you could heat up the car before you walk in.
Exactly. Then you don't have to deal with a lot of that stuff. You just press a button and it starts your car and it starts the heater and everything. And
so my rookie mistake was I thought I would be smart by boiling some water first while I was getting ready, go outside, dump it on the car, and then go back inside, finish getting ready. And,
you just added to the ice, didn't you?
Yeah, didn't.
The ice doesn't work.
I think that ice was even harder than what was already on it. It was bad.
Yes. So I understand.
Yeah.
Well, we're very, very proud to have you down here and practicing.
Yeah,
it's
thanks.
fabulous. I love great doctors, from all around the country that have decided that, the warmth is really where it's at.
Yeah.
And
exactly.
boy, we need you. Not only that, we need you big time down here.
It's an area of need. Yeah, definitely. So,
Absolutely.
And we have a lot of patients from Chicago, New York, Boston, and I think that a lot of these patients are used to these really nice and well-known facilities up north, and I'm proud to say that a lot of us train up there, and we're trying to bring the same sort of expertise and same quality of care down here, and I think that healthcare down here is phenomenal.
Yeah, I love to hear that because it's such a change. Because, 30 years ago, 25, 30 years ago, 40 years ago, we didn't have the same level of health care and doctors down here because it was more seen like a retirement village.
Sure,
so you really didn't have that high quality.
I've heard that, but, in my experience, it's just, I see really well-trained people that are doing really great things for patients, and I think it's phenomenal. I think it's great.
I do too.
Yeah.
Well, it's different. That's what I was referring to. They've really stepped up the quality of healthcare here. So, and that's one of the reasons why we love to have these professionals. We have some of the best doctors here that have been in their field of practice not only for a number of years, but have done amazing studies, and sometimes all over the world that have come down here to Miami. So thank you, All County Healthcare, for bringing these professionals on, these experts, because it's making such a big difference. So your particular specialty is that, what area do you specialize in?
Yeah, so I'm an orthopedic surgeon. So we deal with disorders of the bone, the joints, basically the musculoskeletal system. So, but my specific area of interest and specialty is joint replacement. So primarily hip and knee replacements, and sometimes revisions, redos of previous hip and knee replacements. So that's where my focus is.
Gotcha. Well, I'm somewhat familiar with it, and have known, it's been out for 40 years. But
joint replacement?
Yes. Yeah. But the technology has gotten so much better. Even in the last, 10 years? 5 years?
Right, absolutely. Yeah.
Speak to us about the differences.
So, right, absolutely. If you look at joint replacement historically, I think that it was really popularized about 40 years ago. Hips kind of originated in England. I think that's where sort of the first center came about. And then knees, I think, is sort of originated in New York and Boston. So I think back in those days, it was sort of a novel surgical technique, and it was really it was seen as a really sort of innovative thing. And now it's a little bit more commonplace. A lot of people get hip replacements and knee replacements. I think where the excitement is now is I think we're able to demonstrate that we could improve on a really great surgery in both the short term and long term. And what I mean by that is, I like to break it down into short term and long term. Short term, after hip and knee replacement, I think in the old days, I think you would stay in the hospital for 2 or 3 weeks or something like that. Bed
oh my
bound.
God, yeah, it was a long time.
So short term, I think where we're able to improve on is we have some really exciting new medications and techniques to really decrease that level of pain and really get patients to mobilize a lot quicker, right? So, for example, we do all these different types of more advanced medications pre-operatively, intraoperatively, and post-operatively, so patients virtually feel no pain sometimes.
Really?
And then we also.
Well, I did hear that. I don't mean to interrupt you, but I did hear that if you are looking at going into surgery, one of the best things to do is start exercising that particular area and start really, strengthening
Sure,
the
yeah.
muscles before you end up going to
Right.
surgery.
So that's all sort of part of the protocol. You know,
Okay.
just, sometimes we call it prehab instead of rehab. So it's pre.
Oh, I like that.
Yeah. So that's certainly part of the protocol. And then the other exciting thing is that we're able to perform the same surgery, but we don't have to cut away the muscles and tendons in order to perform the surgery. So some people call it muscle sparing techniques or minimally invasive techniques. Some people call it laser, which is a bit of a misnomer because we don't really use lasers in surgery. But so
Gotcha.
basically less invasive techniques where you don't have to disrupt the muscles and the soft tissue. I think you
That's
recover faster.
That's
Right.
incredible.
So short term, I think the results are phenomenal, are really good. Right? So
Yeah,
patients
because
are,
you don't have to. I mean, that's really what takes all the healing time, isn't it? When the
Exactly, right.
muscles and the
Right.
ligaments have to
heal back.
heal.
And, exactly. So, I mean, the advancement is so amazing that we are able to do these surgeries on select patients as an outpatient surgery, meaning that we do the surgery the day of and then they're home that night.
Really.
So, and that's
That's incredible.
Yeah, that's-
because it was like 2 to 3 weeks.
right. That's unheard of. Even 10 years ago, 5 years ago.
Yeah.
So I think that's sort of where the most exciting advances in sort of in terms of joint replacement is short term. So,
Now, do you
Yeah.
use the robotics?
right. So that's a good segue. So basically, like I said, the other half of it is the long term outcome of joint replacement. So to give you a background, so I think that the biggest predictor of how well your joint replacement will do long term is how well it was put in. I always draw the analogy of a malrotated tire. If you drive on a malrotated tire,
Yeah,
it's going to
yeah,
wear
yeah.
out faster, right?
Exactly.
So if the joint was put in a little bit crooked or not perfectly aligned, it's going to put stress on a certain part of the knee more than the other, and it's going to wear out faster. So then we recognize that, and we all want to figure out how do we put in a knee or a hip that's perfectly positioned, right?
Yeah.
Because before, I think the surgeons just kind of held up. I mean,
yeah.
I'm exaggerating,
I
but
know.
you hold up a thumb and you're looking at it, and you're like, yeah, it looks good. I'm exaggerating.
Or
but-
what is that? The little lever thing
Yeah,
that
right,
that
yeah.
shows you,
So-
if it's straight.
Yeah. So I'm exaggerating, but we use guide wires, rods, and things like that. But it's not. I mean, it's good, but it's not perfect.
Perfect,
It's not
yeah.
precise.
Yes.
So there are a couple of different ways now that we could sort of use, or tools that we could use to really ensure that we like the positioning of the components, right? So you mentioned robots. So the robot is a really good tool because we sort of upload this three-dimensional image or CT scan or MRI or whatever it is into the system. So the robot already knows where your hip or your knee is in three-dimensional space.
Wow.
And then so you're sort of planning the surgery even before the patient walks into the OR. And you know exactly where you want to put the position, the components. And then you basically just guide the robot to that area, and then
And the robot knows? Is it,
Well,
or are you the one guiding the robot?
you're guiding the robot, but the robot will tell you where the exact placement is that you have wanted.
Okay.
So you
okay.
can really ensure perfect placement of your knee or your hip replacement. And I think that will go a long way in terms of providing great long-term outcome, meaning that it's going to last longer.
Well, and that's what the other thing, because, I've got one of my dear clients, and I know he's got to go in for a knee replacement, but his doctor's saying, oh, no, wait until, you can't walk on it anymore.
Right.
And when the pain is just so intense. And I'm like, why would you want to do that? That means that, first of all, your body is going to heal much better right now than in another 10 years. And why would you want to put yourself through that kind of pain for the next 10 years?
You're
It
right.
just doesn't make any sense to me.
I think if you have life-altering or debilitating pain, then it's not worth it to wait. So, yeah, I agree with you.
Yeah.
I think, we try to be conservative if we can, meaning that if there are other modalities that we can offer patients, whether it's injections or bracing or medications, if those things can lead you to have an active lifestyle, then of course
Well,
we could.
most of the time, though, in all honesty, they really don't. Have you ever
Right.
tried to play tennis with a brace on? It doesn't work very well.
Right, yeah. So a lot of time it's not feasible. So so a lot of these patients end up getting joint replacement, and
Yeah.
unfortunately, it's such a good surgery, and everybody goes back to their daily activities, their sports, their
Exactly.
what have you.
Exactly.
So,
That's why I
yeah.
say, why wait?
Yeah.
Get this taken care of.
Most patients that get joint replacement will say, "I didn't know I wish I'd known or done earlier.
Yes,
so,
exactly.
We do hear that.
Yes. Well, and tell me, it's the length of the joint replacement, is that extending now? Because before I heard that it'll last anywhere between 15 or 20 years. Is it being extended now
Right.
with all this new age?
Yeah, I think a
State
couple
of
of
the art?
factors. One is that, if we could use sort of the newer techniques, whether it's robots or imaging or live fluoro interoperatively to ensure the components are well positioned, then it will last longer, right? Just
Right,
like
because it's aligned.
Right, it's aligned. It's not going to put undue stress on just one part of the implant. That's one. And number two is that over the last 10 or 20 years, these various implant companies and engineers have come out with different component designs that are meant to last longer.
Oh,
so
okay.
I think that now, I think a conservative...
What's a life expectancy on a
Right.
joint now?
I think conservatively, we're looking at 20 to 30 years, conservatively, yeah. Although my suspicion is that in 20 or 30 years, when we look back at these patients that we've done, most of them are still going to be fully functional.
Yeah, and
Yeah.
having a great time, but
Yeah.
then the technology is going to be so much different as well.
Right, so-
because just take a look in the last 5 years, as you said.
Right, exactly. Technology is always changing. Although I think that one thing that all surgeons have to be sort of careful is that sometimes new technology is not always good. So we have to kind of evaluate it because we want to use technology that has proven track record.
Right.
So the good thing is that if you put in the implant perfectly, there's proven track record of that doing well. So that's something I'm always excited about. So,
Oh, that's so exciting.
Yeah.
So I just like to take this moment to say thank you to All County Healthcare for bringing these experts on, for helping to educate us, inform us, so that we can make the right choices when it comes to our healthcare. So I just want to say thank you very much. But I'd like to continue the conversation because I find it so interesting because, as you age, wear and tear on the joints and the bone structure and everything. So I'd like to continue that conversation. What else have you seen that you're working with? I've heard of stem cell work as well. Do you
Yeah.
incorporate that?
Sure. I think stem cells, it's exciting. I
is
think
exciting.
It's sort of like this holy grail, this biologics in orthopedics. There's some data that supports the use of stem cell for certain soft tissue pathology, meaning tendonitis or muscle tears or muscle strains. I think there's enough data that shows that it's probably very good for that. Unfortunately, my patient population, where you're talking about joint replacement, where you're already bone on bone, there's not a lot of data to support it. So I don't do a lot of stem cells on my patients, and unfortunately, it's most insurance companies don't really pay for it, so it's kind of out of pocket and it's expensive.
Well, that's true too.
And I'm really upfront with my patients. I'll say, hey, we could do it, but I don't really think it's effective, and it's costly. So I think there are better ways to treat your pain. So, but certainly I think stem cells for certain patients.
Certain patients.
Right.
Yeah.
I think
that might be your prehab, as you called it.
Could be. Yeah. If your arthritis is not too bad, if it's soft tissue in nature, if it's a strain, then yeah, I think it's very beneficial. Yeah.
Excellent. So talk to me about rehab then. We talked about prehab. Now let's talk about rehab.
So rehab, like I sort of alluded to, it's gotten easier. I think our pain control is much better. Patients aren't, miserable, the first 2 weeks. With the muscle sparing techniques and the minimally invasive techniques, again, it's not as arduous. They don't have to wait for the muscles to heal back, and they don't have to wait for the pain to subside to do range of motion and to mobilize. So it's a lot faster. My best patient, and maybe he's not the best, but he didn't really, he couldn't be reasoned with, but he was on his dirt bike riding around his yard and the day after. I didn't want him to do that, but
you're not going to classify him as your best patient now, are you?
Well, he's the best. He's the best in the sense that he returned to activity the fastest. But I was kind of crossing my fingers for him. But
I've had some patients who did that too, and then ended up back in the operating room. So don't try that. Listen, don't try that.
Fortunately, we haven't had that. But yeah, so I think just in terms of the return to the activity is a lot shorter. And we've seen that. And just I think is, like I mentioned earlier, it's the newer surgical techniques, it's the medications, it's prehab, it's intraoperative, preoperative medications. It's the whole thing. So.
And you provide all of those particulars for your
Sure,
your
yeah,
patients.
it's standard. So it's all standard. It's
Wow.
it's sort of standard orders. You know, if we decide that you're a candidate for joint replacement, then we initiate all those steps. Make sure that you're active and your muscles are strong before surgery. Make sure that you get all the medications that are meant to sort of block the pain pathway, so you rehab faster, you mobilize faster, and you're happier faster. So.
It's all very, very important.
Yeah.
Because, I always believe if you have quality of life, you have quantity of life.
Yes.
And so the more that you have the ability of being able to function normally, first of all, the younger you feel, and then more you want to be out and do
Right.
different things and, keep up with your activities, golfing and tennis and swimming and bike riding and
Exactly.
that
yeah.
type of thing.
And conversely, I think, especially in Florida, I think that youth is not just based on the age anymore. I think a lot of people are youthful no matter what age they are.
Right. Well, it all depends on how you feel, how the body is functioning, and whether or not you're able to do a lot of the things that, you did when you were younger.
We have patients who are, in their 80s and 90s playing golf 2 or 3 times a week.
I was going to ask you.
Not unusual at all, and they want to maintain their lifestyle. So.
Yeah, and that's a tough one. Golf and tennis are tough on the knees and the hips.
It could be, yeah, especially with a little bit of arthritis. So,
absolutely.
Absolutely. It's just it's a special patient population down here.
It is. And it's ripe, very ripe as well.
Yeah.
Because there's, everybody's outside. That's what's so nice about this.
Yeah, exactly.
We're not dealing with the upper north
right.
and the wind chill factors.
Yeah, circling back to the weather talk.
Yeah, I know. Well,
Yeah.
That's that Chicago blood in me, It's but everybody's laughing. They say, "But you came from Chicago and you can't handle 60-degree weather here." And I said, "No,
Yeah.
I am cold traumatized.
Yeah.
That's what 50 years in Chicago does to you."
It's different, right? Like 50 degrees here feels different than it feels almost the same as like 30 degrees in Chicago. I don't know why. I don't know what it is.
Well, it's because of the humidity.
Yeah.
I hate to go into that weather conversation, but it's the humidity here. So it goes right through to your bones. So talking about bones again.
Yeah, that's really good. Yeah.
Thank you. Now, do you see that you have the ability of doing the joint replacement in the hips and the knees through arthroscopic? Or is that just...
No, unfortunately. Arthroscopic would mean you're making small portals. Usually it's meant to kind of just go in and sort of clean out and debride and just take a look. You're basically inserting in small cameras. And, obviously with the... Just the limitation of the implant size, you wouldn't be able to put the implant in through small portals.
Okay.
So the next best thing is making smaller incisions, cutting away less muscles, and that's what we're doing.
Okay.
Yeah.
Okay. So you're making the smaller slits, and you're able to pull the muscles away.
Right. For example, you know how muscle fibers look.
Yes,
they
yes,
usually
yes.
run lengthwise. So instead of trying to cut the muscles across the fibers to kind of open, we'll just split the muscle fibers to kind of open, so then we don't detach the muscle fibers attachment to the bone or to each other. So we don't have to wait for the muscle fibers to heal.
I see.
So that's what we mean by minimally invasive. Surgery.
Okay.
Yeah.
I'm fabulous.
Yeah, it's good. I like it a lot.
I would imagine you do.
Yeah.
Well, something, I just want to say thank you so much for taking time out of your busy schedule, because I know how busy you are, and for coming and being a part of our show this evening. Please tell them again how to get a hold of you.
So my group is it's called Orthopedic Surgery Associates, and our website is ortho-surgeon.com, and we're in Boynton Beach and Boca Raton.
Excellent. All County Healthcare provides the doctors that come on our show. So I wanted to put a special thank you out there, because we have some of the finest doctors here. And, All County Healthcare patients are the heart of their business. And what they've done is really tapped into a very... a group of surgeons, doctors that really do care about their patients, that take the time, have patience. They have a certain quality of listening, and they're not there. It's not a fast food where you come in and say, okay, well, there's where the pain is. And a doctor gives you a script, or he says, okay, well, I'm sorry, I only have another 5 minutes, and then you're finished. These doctors that we bring on the show really do care about their patients, and they want the best for their patients. And if you happen to be a doctor and you're listening and would like to be on our show, please give us a call at 888-717-7170. Ask for Maddie. We do this show live every Tuesday between 6 and 7, and we would love to hear from you. And also, if you have any questions for any of our doctors, call Maddie at All County Healthcare. We would love to answer any kind of questions that you might have, not only for home care of what you might need, but also for the doctors that we bring on. Because as I said, these doctors that we bring on really do. They're qualified professionals, they're experts, and they want to help you. So, I'm Lorena Anderson. Thanks so much for being with us this evening. We can't wait to see you again next Tuesday between 6 and 7, where we'll also have other doctors that are highly qualified and in the field. So, until that time, thanks so much. We'll see you next week.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.